My name is Mary Beth Magtanong, and our presentation for today is about the benefits of implementing an EHR and connecting it to HIE. The objectives of this presentation are to discuss the healthcare policies related to EHR and HIE implementation, to explain the meaningful use criteria, to define EHR and HIE, to describe the benefits of EHR, and to describe the benefits of implementing an EHR and connecting it to an HIE. The HITECH Act. On February 17, 2009, the American Recovery Act was signed into law. A portion of the bill is called the Health Information Technology for Economic and Clinical Health Act, or HITECH Act. Included in the HITECH Act is a $22 billion funds for the adoption of health information technology and to increase physicians' and hospitals' use of EHR. The Office of the National Coordinator for Health Information Technology was legislatively mandated in the American Recovery and Reinvestment Act. Through the HITECH Act, the Office of National Coordinator created an incentive program under the CMS reimbursement system to provide incentives to hospitals and physicians who are meaningful users of EHRs. The Office of the National Coordinator is also tasked to establish an infrastructure to promote health information exchange, or HIE, and interoperability of EHRs. What is an EHR? An EHR is an electronic version of a patient's medical history. The Health Information and Management System Society defines EHR as the longitudinal electronic record of a patient's health information generated by one or more encounters in any care delivery setting. It can also refer to the software platform that manages patients' records maintained by a hospital or medical practice. Meaningful use. How to qualify as a meaningful user. The CMS EHR Incentive Program is created to increase the adoption of EHRs. The program will provide incentive payments to eligible physicians and hospitals for the meaningful use of EHRs. To qualify as a meaningful user, providers have to show that they are using certified EHRs and they have to achieve the specific objectives set by the program. The CMS EHR Incentive Program is phased in 3 stages. Stage 1 began in 2011. It is focused on creating information. Stage 1 sets 18 objectives for eligible professionals and 17 objectives for eligible hospitals and critical care access hospitals. We are currently in Stage 2, which is focused on health information exchange. In Stage 2, eligible providers have to satisfy Stage 1 objectives and clinical quality measures. Stage 3 is planned to be implemented in 2016 and will focus on improved outcomes. The objectives of meaningful use is Stage 1. Use of computerized provider order entry, CPOE, for medication, laboratory, and radiology orders. Generate and transmit permissible prescriptions electronically. This is where e-prescribing comes into play. Record demographic information. Record and chart changes in vital signs. Record smoking status for patients 13 years old or older. Use clinical decision support to improve performance on high-priority health conditions. Provide patients the ability to view online, download and transmit their health information. This is the patient portal. Provide clinical summaries for patients for each office visit provide electronic health information created or maintained by certified EHR technology, incorporate clinical lab test results into certified EHR technology, generate lists of patients by specific conditions to use for quality improvement, reduction of disparities, research or outreach, use clinically relevant information to identify patients who should receive reminders for preventive follow-up care, use certified EHR technology to identify patient-specific education resources, perform medication reconciliation, provide summary of care record for each transition of care or referral, submit electronic data to immunization registries, use secure electronic message to communicate with patients on relevant health information. Meaningful use stage 2. The focus is on advanced clinical processes. In stage 2, meaningful users of EHRs have to demonstrate the capability to exchange health information electronically. E-prescribing and lab results must be incorporated in their EHR systems. Electronic transmission of patient care across multiple settings. For example, in an acute care setting, EHRs must allow for storage and retrieval of patients' information from admission to transfer of rooms to discharge. Or if the patient is to be transferred to another facility, transmission of patients' information may be done through the direct communication between the discharging facility's EHR and the admitting facility's EHR if their system allow it. Or transmission of patients' information may be done through a health information exchange organization. Increased patient and family engagement. The patient portal of the EHR allows patients 24 hours access to their health information from anywhere with an internet connection. Using a username and password, patients can view their health information online, exchange secure email with their providers, make payments, request for prescription refills, or schedule an appointment. Benefits of EHR: improve accuracy of diagnosis and health outcomes. With EHRs, providers can have reliable access to patients' complete health information, giving them a comprehensive picture of the patient's condition that can help diagnose patients' problems sooner. Improve care coordination. EHRs can decrease fragmentation of care. Information gathered by primary care providers can be easily shared and reviewed by specialists and other members of the healthcare team. Availability of patient information can reduce medical errors and duplicate testings. Increase work efficiency. EHRs enable improved medical practice management through integrated scheduling system that link appointments directly to progress notes, automate coding, and manage claims. Physicians can review labs, order tests, and submit prescriptions outside of the office. Instead of waiting on faxes or rushing to get back to the office, physicians can view patients' information on a phone, tablet, or computer anywhere that they have an internet access. Reduce medication errors. One of the most important reasons for adopting EHR is the potential to reduce errors. EHRs can automatically check for problems whenever a new medication is prescribed and alerts the clinician to potential conflicts. Information gathered by a provider and recorded in an EHR can tell a clinician in the emergency department about a patient's life-threatening allergy, and emergency staff can adjust care appropriately even if the patient is unconscious. EHR fosters patients' participation. Patients can log into their own record and review lab results and get medication information without having to contact their physician through the secure patient portals. With EHRs, providers can manage appointment schedules electronically and exchange email with their patients. Save cost. Cost savings are primarily a result of automating several paper-based tasks. EHRs reduce the amount of time providers spend doing paperwork. A significant percentage of healthcare costs is from administrative tasks such as filling out forms and processing billing forms. EHRs can streamline these tasks and significantly decrease cost. EHR also eliminates the need for maintaining an extra footage of the facility to store cabinets full of paper files. Health Information Exchange, HIE. The American Health Information Management Association defines HIE as the movement of health-related information among organizations according to a nationally recognized standards. It is sometimes referred to as Health Information Network. HIEs serve as the building blocks for the nationwide Health Information Network. HIE makes the exchange of clinical information between different healthcare information systems possible. Think of HIE as a statewide EHR. The Regional Health Information Organization, RHIO, facilitates the exchange of information. RHIOs are a group of healthcare stakeholders that oversee the exchange of healthcare-related information. Through HIE, providers can send, receive, and find a particular patient's healthcare information. Benefits of connecting an EHR to HIE. EHRs connected to HIE has the capability to acquire complete, accurate, and searchable health information at the point of care, which is particularly important in emergencies when a patient is unable to provide their own identification. It reduces medication error, thereby improving the quality and safety of patient care. It facilitates patient education and enhances patient involvement in their care. Again, this is through the patient portal. Since information is aggregated, patients can see a bigger picture of their health condition, allowing them to make informed decisions. EHR connected to an HIE provides clinical decision support tools for more effective care and treatment. It eliminates unnecessary testing. Patient information is aggregated and shows tests that was already done. EHRs connected to HIEs improves public health reporting and monitoring. It reduces the number of readmissions through better care coordination. It increases productivity. It facilitates the use of technology in healthcare. Providers can access patients' information anywhere that there is an internet access by using his phone, tablet, or laptop. It provides basic level of EHR interoperability. Through HIE, information from different EHR systems can be shared. It reduces healthcare costs. Healthcare-related costs are reduced by streamlining processes, reducing paperwork, eliminating redundant tests, preventing medication errors, and reducing readmissions. This concludes our presentation. Thank you for listening.